Welcome to Caregiver's Note, a podcast on childhood disorders and other mental health conditions. The views expressed in this podcast do not serve as medical advice. I am your host, Nkukune, Dr. Tema, and this is episode 3, The Good and the Bad, Management Approach of ADHD. Below is a highlight of points that will be covered in this episode. First, the complexity in ADHD management. Second, use of medication. The complexity in ADHD management. There are 3 major factors contributing to this management complexity, particularly in children. The first is co-occurrence of other psychiatric conditions contributing to complications not only at the level of diagnosis, but also during treatment. All this might need to be considered for treatment by the treating clinician. The next one is the need for input from multiple professionals, as we shall explore in future episodes. The third is multisectoral government institution involvement, including health, education, and social development. Their roles are activated according to the severity of condition and the co-occurrence of other medical or psychiatric conditions. Use of medication. One major contribution to the intervention in the management of ADHD is the use of medication. Caregivers' general hesitation to put children on long-term medication for any condition cannot be ignored, and this is possibly much worse for ADHD. On the part of ADHD medication, bad publicity in all sorts of media platforms has not helped matters. A phrase often thrown around is children zombified by medication. I do not have a clear description of what this particularly means. But I suppose it could be that child looks sedated on medication. The choice of medication is directed by several factors. These include, but are not limited to, the following: access in the form of availability and affordability, tolerability to medication, and in some cases, caregivers' preference. Availability of medication is guided by which preparations would be registered in the country. Several medication, including stimulants and one non-stimulant specifically registered for ADHD. The market has since been inundated with generic substitutes, which in turn have facilitated affordability. There is another list of medication commonly used off-label. These are registered for treatment of other conditions but have demonstrated some relief of ADHD symptoms. They are, however, less effective in comparison to the registered preparations. Their use is generally considered if the child is not tolerating the registered medication, on rare occasions due to poor response. The other, an unfortunate scenario, is when the caregivers are completely opposed to traditional medication. Tolerability of medication is also a major factor. Some of the problems that can affect tolerability to medication can be identified well in advance. Say one has established risk or history or suggestive features of anxiety, tics, psychosis, for example, might not tolerate stimulants. The other factor that can affect tolerability is side effects. Obvious and genuine discomfort caused by side effects for all kinds of medication cannot be overlooked. Medications are foreign to the body, and so in getting used to them, children might experience side effects. This will often occur at commencement of medication and at times during changes in doses. It is important to check in with the treating clinician when there are unexpected or, on occasion, intolerable reactions. Not everyone will experience side effects, and if it happens, the severity varies from one person to the other. Taking medication requires commitment for consistency because the effectiveness of medication is better measured over a cumulative period. Interruptions may cause problems. Acutely, children might experience ongoing short-term side effects as the body is not given enough time to get used to the medication. Over the long run, children are not able to benefit from the effect of medication and as such discontinue. It is also too much risk to have children take medication without adult supervision. Children taking medication during school time often feel stigmatized. The school should manage medication discreetly to avoid teasing by other peers. It helps to make things as easy as possible for children to use these medications, as this will encourage buy-in from them. So when they are independent, they would also see value in consistency. To summarize what we have just presented, the management of ADHD is complicated by many factors. This include co-occurring medical or psychiatric conditions, the need for involvement of multiple professionals, and multiple government sectors. The use of medication is a major contribution to the management of ADHD, and a consideration of side effects can be anticipated and managed accordingly. Discreet management of medication at school will help minimize children feeling stigmatized. In conclusion, many negative reports in the public domain do not get to describe the full story. It is, however, the caregiver's responsibility to make informed decisions on the interventions required. Otherwise, gullible caregivers will fall prey to schemes promised by alternative treatments, which at best offer temporary relief for what is a lifelong condition. Thank you for listening to Caregivers Note. Do check out our website at www.nsztema.co.za for more resources, our contacts, and the author's profile. Please remember the views expressed in this podcast do not serve as medical advice. Always check with your clinician for any medical concerns or clarity. If you liked this episode, Please remember to share the link with those who could benefit from it. Tune in to our next episode when we present the real work management approach of ADHD 2.